Does maxillary advancement fix snoring? Have you ever wondered if maxillary advancement can actually help with snoring? Let's break it down and see how this surgical option fits into the bigger picture of sleep apnea treatment. Maxillary advancement is part of a surgery called maxillomandibular advancement. This procedure aims to improve airflow by moving the upper jaw forward. When the upper jaw is advanced, it enlarges the airway, which can significantly reduce or even eliminate snoring. Snoring often happens when the airway is partially blocked during sleep. By physically moving the upper jaw, maxillary advancement creates more space in the nasal and throat areas. This extra space helps to reduce the vibrations of soft tissues that cause snoring. In the context of sleep apnea, maxillary advancement is usually done together with mandibular advancement. This means both the upper and lower jaws are moved forward. This combined approach enlarges the airway at various levels, from the nasal cavity to the throat. By doing this, it helps to prevent the airway from collapsing during sleep. Maxillomandibular advancement is considered one of the most effective surgical treatments for obstructive sleep apnea. Many people who snore loudly find that this surgery helps them breathe better at night. Studies show that this procedure can significantly lower the apnea-hypopnea index. This index measures how severe sleep apnea is, and a lower number means better airflow and less obstruction. Patients often report a noticeable reduction in snoring after having this surgery, especially if their snoring is linked to how their jaw is structured. While maxillary advancement can help, it is usually performed alongside mandibular advancement for the best results. This surgery is not just for those with jaw issues. It can also benefit individuals with normal jaw structures who have snoring caused by excess soft tissue or obesity. If you have moderate to severe obstructive sleep apnea or persistent snoring that hasn't improved with other treatments, this surgery might be a good option. Keep in mind that maxillary advancement is an invasive procedure. It requires careful planning, including advanced imaging techniques. However, it has a strong track record of improving airway function and reducing snoring. In summary, maxillary advancement can effectively address snoring when performed as part of maxillomandibular advancement surgery. By enlarging the upper airway and stabilizing soft tissues, it helps reduce the airway obstruction that leads to snoring.